Hello and welcome to the Healthcare Executive Insights podcast. I'm Elliot Sloan from the Macallan Group. And today's guest, we have Mr. Avi Singer, the founder and CEO of ShowedMe, an innovative compliance and training platform. Avi, thank you for your time today.
Elliot, thank you so much for having me. Really looking forward to our conversation today.
Yeah, likewise. So tell me a little bit about yourself and your background, and then we'll learn more about your company, ShowedMe.
Sure. Yeah, that'd be great. My background is in human resources and learning and development. Spent most of my career working for technology companies, so helping them grow. I worked for DoubleClick. We were then acquired by Google. I worked for Google for a little bit. I worked for other technology companies as well. And my primary focus at those companies was helping them grow from the point that they were at initially to where they wanted to get to, and primarily through learning and development. So that was my focus. In 2014, I set out on my own. I thought I had a really good idea around learning and development technology to support the kinds of businesses that I worked for in the technology space. Did that for a few years. And then in 2016, we were actually approached by a number of healthcare organizations who said, hey, we think you're doing something really innovative in learning and development in the technology space, but we think it would be really, really applicable to our space, the healthcare space. We took a close look at that market, saw great opportunity, and formally launched in healthcare in 2017, and that's what we've been focused on since.
Wonderful. So tell me a little bit more about ShowedMe and what separates it from other training or learning management systems out there.
Yeah, really good question. So we designed a platform that was easy to use. So a traditional learning management platform for corporations, it's a little bit complex, right? You need to become an admin. There's certain training you'd have to go through to be able to leverage it properly. And then when healthcare came to us, it was essentially asking that question. Same thing, like we need a learning management platform. We have onboarding and orientation that needs to get done out in the field. We have annual in-service or required compliance training that has to get done on an annual basis. We have ongoing training that we want to be able to train our employees on, whether they're in home care and out in the field, whether in a skilled nursing facility or assisted living facility. We need an easy to use platform. That's what they came to us. We took a look at the market and healthcare and said, wow, there's certainly a lot of content providers. So there's certainly a lot of content that's out there. But we didn't see a technology platform that was a leader in the healthcare market and thought, hey, that would be something we can do. And we've been doing that since 2017 and it's been great.
Talk to me a little bit more about the type of healthcare clients that are using your platform.
Yeah, so we initially were approached by home care agencies who, up until we came in, were actually bringing all these employees into the office for all their training, right? And I remember visiting some of these home care agencies, and you would literally just have, it looked like the DMV, right? You just have hundreds of people sitting in waiting rooms waiting to be trained. You'd have lots of people sitting in rooms being trained. There were people walking out. It was just this massive, because you're talking about, organizations with 4,000, 5,000 caregivers who need 10 to 15 hours a year of training that's all being done in a facility. And organizations were using all kinds of interesting ideas. We had one client who was using like a massive catering hall. They would have like a Sunday where like 1,000 employees would show up and they would do 6 hours. So it was just very inefficient. Not a lot getting done really when you cram a lot of people into a room and just death by PowerPoint. And they were looking for something that could be deployed in the field. So again, it would have to be easy to use. It would have to be multilingual. It would have to be supported, right? So a lot of caregivers in home care or even in skilled nursing, they're not comfortable with technology, right? So if they can't log in, if the password's not working, if the video's not playing, like they need someone to help them. And that's what our platform offered. So we started out in home care. We've also done a considerable amount of work in the skilled nursing space, assisted living, as well as early intervention. Organizations that will deal with employees who focus on developmental disabilities and things like that as well.
Yeah, I mean that makes a lot of sense with your audience. It needs to be super simplified, and I imagine a lot of people are doing the training from their mobile devices. Are you an engineer? Computer engineer by trade, or what helped you bring such a sleek user experience to your clients?
I don't get that's a good question. I ask that question a lot, but so I was very fortunate early in my career because I worked for technology companies. When I had an idea around, hey, we could improve our orientation process. or we can implement this sort of training. I worked for organizations that fortunately would say, hey, could we build it ourselves? We have engineers, we're technology companies. And they would allow me to actually borrow like internal engineers who are working on other projects, and I would have the opportunity to sort of build my own tools. So that gave me the confidence that if I could understand the challenge that I wanted to address and could really sit there and figure out, so, again, I don't have an engineering background. I still struggle with pivot tables in Excel. But if I could really simplify the problem and really sort of spell out the solution, maybe I could do something. So I remember when I started Showed Me, I probably wrote 20 or 30 pages of requirements. Like I really sat there and said, like, this is what a login page is going to look like. And this is what, and I really, my thought process was, and the filter I used was, let's make this so easy anyone could use it. And to date, that's always been our thing. Even though we're always thinking about innovation and new solutions, it's always like, okay, but let's understand our environment. We currently, to give you a sense of what I mean by that, we currently average around a 90% completion rate for training that we deploy out to the field, right? That means 90% of the people that we send training to and say, you have to do this training or training is required, are able to do it completely online. We also have over 90% user satisfaction rate, and those numbers are super important to us. And in order to do that, the users have to be happy. So we think of everything through the lens. So I'm not an engineer, I don't have that background, but I do have this sort of ability to be able to think through a process and say, like, yes, that's exciting. Yes, that's innovative. Yes, it's different. But again, let's stick with our mission over it. And our mission is, let's make sure it's something that that our audience is going to be able to take advantage of.
Sure. So you're the brains who are able to map it all out, and then you have the team who could develop and implement.
Exactly. That's it. The other thing that we did, I think, was very helpful in our industry, and not to disparage any of our clients, we love them all dearly. We found that the agencies that we work with, or the skilled nursing facilities, they're not super technical either, right? So one of the things that we realized early on that would be a secret to our success was actually managing it for them. So when we go into these clients, what we actually tell them is, hey, you know what? We don't want to teach you how to use the system, and you'll have to upload your content, and we'll take care of it for you. You sit down with your account manager, you let them know who you want to have trained, what you want them trained on, when you want them trained, and we'll handle everything for you.
Yeah, I've messed around with a few learning management systems, but I've had clients who've asked to assist them with flushing out a more efficient training process in healthcare. So maybe I'll have to connect them with you. But I've always noticed, well, the biggest problem is the content. Who's creating all the training content? Setting up the videos and the process to make sure every employee is correctly finishing each step. That is extremely important. But I think the content and the information is the challenging part for a lot of organizations.
Absolutely. I mean, that was one of the bigger challenges for us. So when we heard the challenge that our clients were dealing with and thought about, yes, we can solve it from a technology standpoint, we then said to them, okay, what do you have any content? Because we don't have content. They would give us content that was just outdated, boring, right? Just real checkbox stuff. And we realized that part of the secret to our success was not only going to be the technology, but it's also going to be providing the right type of content for those employees, right? We had agencies and nursing facilities who were leveraging content that was more appropriate for the nurses, right? And I think was beyond, and the nurse has multiple years of education, undergraduate degrees, often a graduate degree, licensure, and they were leveraging it for a home healthcare aide or a certified nursing assistant who wasn't quite there yet. So we were very, very thoughtful about that and sat down with many of our clients and many of their staff and said, hey, what content do you want? How do we write it in a way that can be understood by the audience that we're going to be deploying it to? How are we going to test for that proficiency? What should a quiz look like? And really spend a lot of time thinking about it and being very thoughtful about it. So one of the things that we focus on is not about creating a lot of content. Right? We tell that to our clients. We're not going to be that company that's going to have hundreds of titles or thousands of titles. We're going to have everything that you need, but your employees are going to be able to learn from our content, and they're going to enjoy it, and they're going to appreciate it. And we get that feedback a lot. We get the feedback, hey, this was a great course. I actually enjoyed it, right? It was interesting. I learned something I didn't know before.
Now, you said a lot of the training that you are assisting your clients with developing is specific to patient care. So does it require your team to have medical professionals developing a lot of the course and training material and copy?
Oh, absolutely. Absolutely. So we have a very, very large network of consultants. Everything that we're creating is vetted both on the clinical side, right? Making sure that that's right. And then it's also really very closely vetted on the educational side, right? Is this getting the message across? And we do a significant amount of testing on our content, right? Before we roll it out. We're very fortunate to have, great clients who will tell them, hey, we've got a new course, right? It's on, fall prevention. Can we try it out with maybe 100 of your employees and see how it goes?
And now most of your clients are requiring your team to produce most of the materials in their course?
Yeah, I mean, again, we definitely work with our clients. Many of them have years of their own experience and have their own materials.
And
right?
you just update a lot of it.
Yeah, we'll work with them in lots of different ways. There's some great really tools out there. So, we're not taking a PowerPoint and just putting it online for them. They do have some courses that they feel very strongly about, that they're very close to, that their own staff have created. We'll help them figure out how to put it in, create an online format for it that's interesting, that's engaging. Voiceover, using the actual person to do the training. There's lots of things we can do. And again, I think that's another thing that's helped our clients move online, is our willingness to work with them and not just say, like, here's your package, do it. It's like, hey, how can we work with you? How can we make this comfortable for you, for your staff, and for your nurses and those who've been doing this training for all those years?
Do you have to keep a team of video editors to keep up with demand of video creation?
Yeah, so the answer is yes. I mean, the number of people on our team is astronomical, actually. Many of them are consultants, right? So we have a number of people full-time on staff who are experts in instructional design, clinical compliance training, experts at video editing and course creation. But we also have a very large network, as I mentioned before, of people who are doing the writing, who understand the audience, who people who are doing the design, people are doing the video, the animation that we use, the interaction that we use. So we've been very fortunate the last few years to build up a really nice network of consultants that we can leverage, and they literally number in the dozens. I think,
sure.
In terms of when you think about just all the different content we need to create.
Talk to me about your go-to-market strategies. How have you been able to acquire and attract new clients?
The nice thing about healthcare in general is people in healthcare talk to each other. There's a lot of, competition, frenemies. And, somebody would, say, hey, how are you doing your online training now? And they would say, hey, you showed me, how's it working? And then, so a lot of it for the first few years was very much word of mouth, was very much a targeted approach that we had. This year, starting last year, but really mostly this year, is we're really started to get out to the market and start telling our story. So we've hired a head of product, a head of marketing, a head of sales, and we feel like we're not selling a potential story. We're selling our actual story. Like, these are the numbers that you will see if you work with us. So this is the first year we've really been made a ton of updates to our website. We've been doing webinars. We've been going to a lot of conferences. We've been doing podcasts like this one. We've been really getting our message out there to the market that, hey, if you're looking for what we have to offer, the type of supported platform, the type of completion rate, the type of hiring rates that we're supporting, there's a company out there that's doing it.
Tell me about what are the future plans and what's on the horizon for ShowedMe.
And the primary focus is always going to be again helping our clients be compliant, right? I mean, at the end of the day, many of our clients are funded through Medicare and Medicaid dollars, and compliance is top of mind for them. It's not just a checkbox; they really want to be compliant. They want to do the right things. The things that I like to think about, and I hope that we can get to, and we've already started the work towards this, is really around improving care, right? Like, we talk about it all the time internally. Like, yes, are we getting our clients passing every survey and every audit, and they're able to hire people and retain people? Like, yes. And those are things that, like, most of our technical work and most of our product development is around that. How can we make onboarding even easier, and orientation even easier, and in-service even easier? Like, how do we make those things easier? But in the back of our minds, we're always thinking about, imagine if we could figure out how to leverage our platform to actually impact care, right? And as you see more care moving towards homes, right? So hospital at home as a concept, people moving away from skilled nursing to a certain extent and preferring to be at home. This means that you have millions of patients, right, who are living at home, right? And you don't have the opportunity like in a facility where there are nurses there and there are doctors there and there are other people there throughout the day. It's there. So how do we deploy training out to all those people who are there, whether it's the staff, whether it's the family members, whether it's the patient themselves? So that's what we think about a lot, right? We think about this whole sort of ecosystem around care and how do we educate everyone on the things that right now we're only educating some people on. And I think ultimately that will improve care.
That makes a lot of sense. And it's, exciting to hear that your platform might be shifting as time goes from B2B to B2C. You might be going direct to consumer to every household that has someone who needs care given to help them train on simple protocols on how to make sure they're delivering the right care to their loved one when that CNA is not right in the room with them.
We actually have a program now where we help a lot of patients and caregivers get tablets and internet. So that was our first step towards that, is make sure everyone has access to the technology. If they don't have access, there's no place to start. So we're in that process. Right? We're working towards that. People always say like, how long am I going to be doing this? I'm like, forever. I love it. I'm like, it's great. So hopefully I'll be here 20, 30 years from now talking about all the innovations in healthcare and healthcare education.
Sure. Yeah, I don't think we're too far away from Web 3.0 having a real rollout. And we know that healthcare, a lot of the systems and processes are archaic. So for someone like you who is an avid problem solver, I think you can keep yourself busy for the next 20 years solving problems within healthcare.
Hope so.
Avi, thank you so much for your time today. It's been really awesome learning more about your compliance and training platform. We'll definitely stay in touch and we'll check in with you in the future to get some more updates about Showed Me.
Thank you so much, Elliot. It's been a great conversation. Really appreciate it.
Awesome. Have a wonderful day. We'll be in touch.
You too. Thank you.